Hi, Fouad. How are you doing?
Doing well, thank you.
Thank you very much for joining us on our channel for the Pathway to Precision Medicine Symposium. So to let our audience know, could you a little bit introduce yourself to them?
Yeah, absolutely. First, thank you for having me. It's an absolutely great symposium and great event. I'm Fouad Chebib. I'm an adult nephrologist, a physician scientist at Mayo Clinic in Florida, Jacksonville. I study polycystic kidney disease. That's my interest, both from the clinical side and the basic science, all the way to precision medicine and imaging and artificial intelligence.
That's great. So exciting. What is your personal definition of precision medicine?
Yeah, great question. So again, in my space of polycystic kidney disease, which is an inherited kidney disease, patients are born with a genetic disorder, a multisystem, a lifelong disease. We want to understand these patients. It's a complex disease, right? And it has a high phenotypic variability. It has genetic heterogeneity. So basically, not everybody are the same. Patients are so different from each other. Even within the same family, there could be a big difference between their phenotypes. Someone can reach kidney failure in their 30s and someone in their 70s. So huge gap even within the same inherited pathogenic variant. So it's very important for these patients to be so precise in understanding, one, what's their trajectory of the disease, and then two, as we're understanding the mechanisms and different treatments for these patients, we want to get to a place where we can treat patients very specifically. So even within the same family with the same disease, we can treat someone with a little bit different than the next person. So we want to be very precise in the diagnosis, in the prognosis, and in the treatment plan. And that's how we want to bring all the data, whether imaging, omics, clinical, genetic, radiogenomics, put it all together, understand the disease, and be so precise for each patient to tell them what they should expect and also try to treat them appropriately.
That's excellent. Can you share with us a project or initiative that you are working on just to achieve this vision?
Yeah, absolutely. So again, it's a big process and a big project in a sense that it has different aspects. So the first aspect is to understand the disease, the pathophysiology. So we have this wet lab, basic science lab, where we're understanding polycystic kidney disease, finding new targets, new therapies, but also being a physician who takes care of patients in PKD with a large PKD clinic. We see patients every day and we want to understand, kind of tell them right that moment what to expect from their disease trajectory and also give them some treatment options. In order to accelerate these kind of discoveries from bench to bedside, we want to help in academia, the industry, so pharmaceutical companies, to help them say, okay, even if we have an asset, interventional product, and we want to try seeing the efficacy in PKD, we want to help them really de-risk it and understand who's high risk of progression, and within those 2 to 3 years of clinical trials, we can achieve the goals of proving efficacy. So that said, not all the patients should be treated. So now we're trying to collect, we have a very large data set of patients with PKD, with imaging, genetic testing, and clinical data. And we're trying to have models where we can predict the outcomes, basically understand who has rapid progression and who has slow progression. And that's so important, again, because you want to prove in 2 to 3 years a medication is working or not. Otherwise, no one is going to come and come to the field. And then, so we cannot move the field forward and we cannot slow the disease for these patients who are, going through through PKD.
That's amazing. Since you are on the field, actually, you are in the patient side and you are also on the full spectrum. Can you share with us 1 or 2 real bold problems and challenges for you?
Yeah, so within the same realm, one data set is not enough. So it's very important to understand how you can bring different data sets come together and then kind of talk with each other with all the regulations that's around it. So we want to create an international registry, for example, and not just a registry at Mayo Clinic. We have one of the bigger data sets, again, with 6,000 patients and so forth. But we want other data sets to validate, and we want to accelerate prognostications. We want to accelerate biomarkers. And that also feeds into clinical trial and into getting treatment to patients. So it's all coming down to the patients. So one challenge is how do you get all these big centers to approve to share data? And we're going to be learning, and we learn about federated approaches. We want to be as within the policies, but also we want to be creative in ways that accelerate and kind of remove these red tapes and paperwork. So hopefully in the future, now that data is so important, there's more easier regulations where it keeps the data safe, but also helps accelerate the innovation, partnership, collaboration. Yeah.
That's good. Just one last question. We all agree that precision medicine is an interdisciplinary endeavor.
Yes.
What do you think about such events that try to bring these different avenues of thinkers can build in the precision medicine era?
Yeah, this is, by the way, very visionary to bring all the people within Europe and international speakers from different disciplines. So that multidisciplinary approach opens up your eyes to different things that you were not aware potentially about, all the advances in technologies, but also all these phenomenal stories that tells you, like, you start from one patient and now you have...
we got that story, it's amazing.
It's just like inspirational, yeah. Right? So those bring a lot of inspirations to the group, but also collaboration. Now that we've met a lot of people from different fields, it becomes much easier.
And he's a nephrologist, so that echoes with you.
Yes, absolutely.
My dear Fouad, thank you very much for your kindness and for your time, and we're very happy to have you on our symposium and our channel. Thank you very much.
Thank you.